at previous meetings, we've shared that one of our core teams is titled Workforce Housing. It's a group of individuals and organizations that come together and we discuss strategies and ideas on how we're going to address the different housing needs, in this case, workforce housing. The map that Hiapo is putting up represents the flood layer in the firm maps, which is basically showing issues of concern regarding flooding or flood channels, drainage, etc. But what I'd like to point out is you can see kind of like in the middle of the picture where it says Hawaii County 155166, it's calling out a parcel that where the H is sitting on that parcel. That white square just above it is a church, and that's just within a few hundred feet of Hilo Medical Center, which is that big building just to the right. That's white, and then further on down you can see like the white crosses that represent the Yukio Kutsu Veterans Home, Extended Care, etc. Just to the left of that Hawaii County parcel is a state-owned parcel. It's 1.89 acres, and it's zoned residential. It's actually owned by DLNR, the state. So within one of our last core team meetings as the workforce housing core team, myself, Sue, and Carlo were having a conversation about the concept of identifying these parcels and looking at opportunity to collaborate with the parcel owner, in this case, the state, and to maybe pursue a concept of an experimental housing project focused on workforce housing. Like I said, this parcel that's roughly 2 acres is zoned residential, owned by the state, and would appear to be an ideal opportunity to promote a concept of a workforce housing, to provide housing for the various healthcare workers that provide services at these different institutions or organizations on that Wainui corridor. Like I said, you have multiple. You have Kaiser Medical is there, you have Haleanuinui, you have Hilo Medical Center, Yukio Kutsu, as well as the Oncology Center. So right in this very short block, there are a number of essential healthcare providers that struggle with workforce retention and recruitment, with housing being one of the barriers to that. So looking at that 2-acre parcel, we had the conversation, and Carlo, as everybody recalls, is part of a joint venture that is working hard to provide affordable housing developments around our island, 2 on the books and in progress, 1 in Kona, 1 here in Hilo. And he saw this as, again, another opportunity for his joint venture to see if there's a way for them to get involved and maybe even take the lead on building this project. So as part of the discussion, we left the meeting with some action items. One was for me to send Carlo all the research I had done on the parcel, to start to have the conversation with the state, which I had done prior to that. And I also reached out to Susan Kunz, who's the director for our Office of Housing and Community Development, to just have that conceptual discussion of workforce housing on that parcel. My conversations with Dan Brinkman as the director for Hilo Medical Center, as well as Lisa Rentz, who is the director of the Hilo Medical Center Foundation, was met very well, very positive from them. Like, yes, we would definitely support and we want a part of this project. My conversations with Susan was that yes, she with Office of Housing would definitely support this idea and concept, and is standing by to see where they can be part of the project development. My initial conversations with the state, DLNR, were also very well received, and with their basic comment to me was, Darryl, we don't do housing, and because this property is zoned residential, we'd be more than happy through an executive order or other process, turn it over to the county and work with nonprofits or other organizations to develop it into a housing project. So part of that research, like I said, was before I get too far along and get too excited, was just validating a few things. One is, how do we look as far as flooding? So bringing up resources like this and verifying that we have no real flood threat or problem associated with this property, which again is maybe one concern when we start looking at potential going forward with other properties to keep in mind. You know, bring up the other slide, Jaco. Not the structure drawings, but the other. Yeah, that one would work. So I don't know if everybody can see it. Again, very small print, but on the TMK information, it more clearly delineates the boundaries and the site itself. Again, showing you the location with respect to the other properties in the area, the streets. So when you look at it from a development, again, my layperson's perspective of a development, with having good access to multiple traffic points, with Waiau Street, with Wainuinui being within walking distance, literally from all of those facilities. And an observation I've made with the parking lot at the church is many of the employees who work at those facilities down the road park at the church and walk to work because there isn't adequate parking in those various institutions. So if you created workforce housing in this area, again, people wouldn't need to drive to work and park. They would basically could just walk to work. So a very easy and multimodal transportation corridor for healthcare workers in that area. If you can go to the last graphics, yeah. No, I guess the other file that I sent you. But the other map I was gonna bring up with the other file was just to show that, again, some of the things that go into researching the parcel was looking at available water credits. We know that that's always a hot topic if you're gonna develop a parcel. Is there adequate infrastructure? And in my conversations with the director for Department of Water, he basically tasked his engineering team to do a more detailed, in-depth assessment of the available water credits on that parcel. As we shared in a previous meeting, Department of Water Supply, at the request of the Housing Coalition, did kind of a very high cursory view of their water system. And rather than put down very specific water credit numbers or areas defined as optimal versus maybe not so likely to support, they came up with generic descriptions of the areas based on probabilities. And in this particular area, there's a high probability that there is available water credits. The other thing that I researched was the location of the county's wastewater system. Now, the line stops just around the area of the Kaiser Medical Facility. So it's within just a few hundred feet of this particular parcel. So for me, it's looking at parcels that have so much to offer in the form of infrastructure that's close by, ease of access, minimal impact to the community. Because when we looked at the site of only being 2 acres, if you put in, let's say, a few duplex units that would provide either individual or multifamily housing capability, the impact in the area would be, again, my personal opinion, layperson opinion, very, very minimal. It's not going to add significantly to traffic. It's not going to adversely impact the area. And one of the things I shared with Carlo, Susan, and others, to the point of not in my backyard sentiments often expressed with new projects, I don't see that happening in this particular area, given what the purpose is to support our healthcare institutions and organizations. And the other part to that is, for me personally, having grown up in that area and knowing a lot of the residents and community members in that area, if ever there was a project that would have community benefit like this, I would be more than willing to go door to door and talk to my neighbors and share perspectives, as well as get their perspectives on whether or not they would support something like this and get their feedback. But it's taking it to that personal level of getting out there and helping to address maybe sometimes the misunderstandings and myths that perpetuate not in my backyard. The last thing I asked Yapu to share is just, I brought back to our organization here and asked my bosses if they're okay using our own design professional here, but to just do some conceptual drawings of what those housing units could look like. Not that we would be building them or doing it, but just to give some thought to it or some discussion points with, again, they don't have to be big, monstrous, multi-level units, given it's only 2 acres, but to show that you could provide a fair amount of additional housing capacity, housing resources, by looking at it from a very small perspective. I guess the point I'm trying to make with all of this is that all of this came together amongst the three of us through participating in the Housing Coalition. And I know that for many of you that come into the meeting every week, you may have ideas, you may see opportunity and bring your network to the table to discuss things. And that's really what I'm trying to stress is this, one of the huge purposes and benefits of the Housing Coalition is providing that space, providing that forum and venue for all of us to come together, share the ideas. And I'm also going to now make the plea and share in getting the work done and help with sometimes doing some of the research and some of the background work that needs to be done. I know everybody's busy. We're all working hard. Many of you are in organizations that have limited staff, but really it's about coming together and how do we do this together as a community.